And with this, we're going to move into our opening ceremony. We are kicking off our opening session with strategies for resilience, defending diversity amidst fear in the workplace and community. And joining me for this session is a friend, colleague, and mentor, Dr. Dora Ann Mills, who serves as the Senior Advisor for Public Health at Maine Health. A little bit about Dr. Mills. Raised in rural Maine, Dr. Dora Ann Mills is a pediatrician and a public health physician who focuses on bridging healthcare, public health, and social conditions that shape health outcomes. Dr. Mills serves for 15 years as the Maine State Health Officer and Director of Maine CDC, leading responses to major public health challenges, including H1N1 and driving significant reduction in teen smoking rates. At Maine Health, she advances a regional model integrating healthcare, public health, and community partnership to strengthen public health and population health, particularly in rural setting, as well as her work shaped by her global experiences in Tanzania. So welcome, Dr. Mills. I'm so honored to be in this session with you, and over to you.
Thank you so much, Isa. And Dora is fine. And I am very fortunate because I work with Isha pretty much we're partners every day, our work partners. And so I am very, very fortunate to get to work with Isha. And I also want to thank you, Isha, and Hamza, and others, the organizers of this wonderful conference, for being so pivotal and being able to pivot to an online format. So hopefully next year we'll be back together in person. But Isha and I are going to tag team on this. But we thought we would do is actually I'd take you back to another time when we overused the word pivot, which was about 6 years ago when we we're in those early days of the pandemic, and we really were facing the reality of the invisible web, realizing that we rely every day on our basic needs, such as buying groceries, driving on the highway, accessing hospitals, all in healthcare, and all the functions that the many, many hands that make those experiences possible. And although most of the time these systems operate just smoothly, so we hardly even aware of them, we rarely stop to think about the workers who keep those all running. And I think the pandemic with COVID, those early days, really revealed to so many of us how interconnected our systems are and how much we depend on one another across roles, sectors, and communities. So I remember, for instance, we were so worried because in those early days, we had to keep, grocery stores had to stay open. But then we realized like people working at the grocery stores, and I go, for instance, commonly to the Hannaford supermarket on Forest Avenue, and they have a lot of immigrants who work there. And so it was pretty striking to realize that so many of them were at higher risk because those first several weeks where we didn't have adequate PPE or barriers, I mean, eventually they put up the plexiglass barriers and people got masks and things like that. But remember, we had you could see they put things on this floor to tell you where 6 feet was, so you could stand 6 feet apart from each other in the line. But still, before they put the plexiglass up and had masks, you had people who were checking you out who could not be 6 feet apart from all the customers. And so, and in healthcare, we ran in to that as well, where had to preserve PPE a lot for those, who were nurses and doctors on the front lines taking care of patients with COVID. But then we had a lot of other people who were also on another type of front lines, working in environmental services and food services and the like. And it was very tough to keep everybody 6 feet apart and keep working. And we didn't have enough, again, PPE um, and things like that. So, and then it was sometime, I think in April or so, we had a big outbreak amongst another employer in the area who hires a lot of immigrants, and it spread quite quickly amongst the immigrant population. So for several weeks, we had very, very high rates of COVID amongst our BIPOC community. And we really felt it because we could see that so many could not be coming into work because they had been exposed to COVID or had COVID. So we saw that in healthcare. We saw that in our nursing homes. We saw that in the grocery stores and the like. So it really was quite striking that where we saw so many of those, the impact of COVID on our BIPOC and immigrant communities. Then fast forward a few months later, when we were also dealing with the vaccine clinics, between the early days of COVID, and then the vaccine clinics a few months later, I think a lot of us realize at Maine Health and many other healthcare providers, we realized that, well, we can't do this alone. And we know that we have our immigrant populations, particularly, were at higher risk because some of the frontline jobs that they were carrying on. But we also couldn't just help them single-handedly. And it was really the philanthropic communities and then state government, when they started getting the federal funds for COVID, started providing funding for ECBOs, ethnic led community-based organizations. It was very palpable from where I sat at Maine Health. When we saw that the ECBOs, when they started getting some funding, and I wasn't not saying it was a lot or enough, but it was funding that we could feel the difference, because suddenly we had organizations like MANA, the Maine Association of New Americans, was able to provide car rides for people to go to medical appointments and go to vaccine clinics. And we felt it because we could see that, oh, our job at Maine Health was so much easier when we had partners in the ECBO world who could fulfill a lot of the basic functions of providing transportation, information, being able to translate culturally as well as linguistically information that we were trying to get out to how to keep safe. There were a number of phone calls that were or Zoom calls that were convened to help with that, and it became so much easier to have. We could see, for instance, that people were getting, when PPE became more available, that ECBOs were stepping up and providing PPE to their communities and the education on how to use it, masks and the like. And then with the vaccine clinics, we could stand up vaccine clinics, but we had a hard time figuring out how to reach out to our BIPOC community, as an example. And our ECBOs did that with us and for us, and that was extraordinarily helpful. So I think that it taught us a lot, that whole experience with COVID. It taught us that really work everyday systems may appear seamless because of so many unseen workers, and that disruptions really reveal how interconnected our systems really are, and how our global and local systems are also reliant on each other. But how the people we often overlook are essential to system stability and for our whole society stability. But it really was the working together piece that we learned through how to solve this issue. So having those partners in the ECBO community really were extraordinarily just absolutely critical. I mean, we could not have gotten through the pandemic as successfully as we did without the ECBOs. So, Isha, we're going to tag team on this. So I'm going to take a few minutes, and Isha will take a few minutes. We'll go back and forth. So I'm going to pass the baton over to you, Isha.
Oh, thank you, Dora. I think what you just described here, this invisible web that keeps the system functioning is just so incredibly powerful. And the way you help kind of repaint the picture of so many of us working, whether it is in healthcare, public health, or just in communities. You're right. We really began to see the web clearly during COVID. Suddenly, the connections between people, jobs, and systems, what that is usually invisible, became so visible. And we saw how, as you just mentioned, how a disruption in one place has a ripple effect locally, nationally, and of course globally. And this kind of brings us to where we are today. We are, as our world is evolving, we today are seeing a new kind of disruption that is emerging. This one is not a virus, it's not a natural disaster, but nonetheless is a disruption. And we are seeing more often than not that in workplace right now, we are being driven, disruption is really driven by shifts in policies as well as rising social division that we see across our nation. And I think if we all here just took a moment to even reflect, I think we can probably come up with examples within our own work, whether it is navigating misinformation that spreads through online conversations, or whether it is new policies that are changing how organizations are starting to operate, or even just the overall uncertainty and fear amongst employees about what's happening in our community. So in Maine and across our country, we have seen these examples, whether it's from immigration enforcement activities that have created a lot of fear in the community, to misinformation about public health that affects how people make their decisions about health and work. For me, I think taking a step back and piecing it all together is that these disruptions are shaping whether people feel safe to come to work, whether they feel safe to speak up, or even participate in everyday life. And when employees begin to feel unsafe and uncertain, the impact goes beyond just the individual, and the system is impacted as a whole. It determines if we ultimately, I think the question as we're thinking about leadership and resiliency is if we will have a workforce, if we will have functioning hospitals, functioning economy, and a stable community. And that's why, Dora, I so appreciate you taking and others having this conversation about the role in resilience and diversity and why it matters. And I'd love to hear from you if you can talk to us a bit more about what it may look like in our workplace today with these new disruptions that we're seeing firsthand, how they collide with the critical functions of a system, well-being, inclusion, and diversity.
Yeah. So, I thought I would retell the stories, a little bit of the stories from the pandemic, kind of to jog people's memories about how much we pivoted then,
Yeah.
as we're pivoting, still pivoting now. And also in the chat, I mean, feel free to share, anybody, your own perspectives on these stories. I'm just telling from my own perspective, but I know we each have our own stories from there. So any lessons that you find in common to the ones I learned or the ones I'm sharing, feel free to share, or different lessons. So we learned, 6 years ago how much we really all needed to work together, and the ECBOs were so critical in all that. Um, and then in January of this year, when we had the invasion of ICE, the enforcement coming into Maine, and very suddenly we found ourselves in a different kind of situation where we had a number of employees across Maine Health, and particularly in the greater Portland area, who were very afraid to come to work, and understandably so, with all the arrests that were happening. So, and that particularly hit a lot of our frontline services that we don't, when you walk into a hospital, you don't necessarily see. You're looking for the people in the white coats, the doctors and the nurses, and but yet the foundation for so much of what a hospital healthcare does is based on environmental services, food services, patient transport, those people who transport patients from their hospital bed down to X-ray, as an example. And so many of them in the greater Portland area are BIPOC or immigrants. And so, understandably so, pretty much overnight, were afraid to go to work, and some of them had also been detained by ICE, and so obviously could not go to work either. And so, but yet, when we called upon the ECBOs, they were in a similar situation, right? So they were having and some of you, I think, do work at ECBOs, and no, it was terrifying, absolutely terrifying. And so they were saying, well, we can't provide the normal transportation because we thought, well, one thing we could do is a number of our team members who were in the groups of people who felt that they could not leave their home and come to work, they said, we don't feel safe to even leave our home, our apartment, or whatever. And we don't feel safe getting into our car and driving because ICE knows the driver's tags on the car. So we then, called upon friends and ECBOs, people we'd made friends with 6 years earlier, um, to say, hey, can you help us out and go, and provide transportation for our team members to come into work. And they said, no, we're not. We're not. We're ECBOs, and most of our workforce are also in the same category of BIPOC immigrants, and don't feel safe to leave their homes either. So, so one morning, I wish we had a crisis with some of a number of our EVS workers couldn't come into work. EVS meaning environmental services, and I ended up calling, I literally just I texted some friends of mine who are not in that category, but or mo some mostly white women who I know in their 50s, 60s, and 70s who mostly live in the outskirts of Portland. And I said, any chance if I gave you some names and numbers of people, phone numbers, you could call them and tell them you'll come and give them a safe way to work. And they said, oh my gosh, of course we would. So they were, also just horrified at what was happening, but wanted to help. Um, so and literally within a few minutes, my phone was just was going off and off because they were texting my text to others. And so I had all of a sudden all these people who wanted to help. And I said, well, at some point we can't have you all this, finding, helping people, but you can, I mean, driving people to work. We just need a certain number. But I did refer them to some ECBOs, and I said, just reach out to any immigrant and just see, or anybody who's BIPOC, because sometimes people are not immigrants, but are just, or of color, and just felt unsafe at that time. I said, just if you could reach out and just make sure that people are feeling safe and seeing what you can do. So within a day, we had our vans, so our buses redirected. So if you're anywhere near the main medical center, Portland campus, you'll see these they're small buses that have Maine Health over them on the side, and they drive employees from Maine Medical Center from the parking garage, which is down on St. John Street, up to the hospital. And they go around in circles, like there's a bunch of them that go around 24 hours a day. And so we redirected some of those to go pick up people from work. I mean, not so from work from their homes to work, because then they were in a small bus that said Maine Health, and it was felt like a safer place to be, and they could take the bus to work. But then we also realized that people needed food because they said we're not safe to go to the grocery store. Well, we have a food pantry down the street from Maine Medical Center on Congress Street, the old Greyhound bus station. And so we quickly pivoted. Again, the word pivot seems to be used in all these situations. And we started boxing up food and transporting them up to Maine Medical Center. So when our people who were being driven to work by one of the vans, when they left work, they'd get a box of food to go home with for their families. So we did that for, I think, a couple of weeks. We can't still do it. I mean, people were asking us if we could continue, but we were taking those buses offline from transporting, employees back and forth. But we were able to do that for a while, and it helped a lot to try to keep the foundational services of the hospital open and running, while also helping our team members feel safer. I mean, it didn't solve all the problems, but it helped them feel a bit safer and give them a sense of safety in their transportation to and from work, and some basic food for their families. So that's, it was an interesting experience that we learned from, because I think we all learned that we rely on each other back and forth, so it's really getting through all these crises, together with the not and not singularly, but together. A similar situation I witnessed with my son. He helps uh, he and several friends of his run a soccer group called Kennedy Park Pickup Soccer, and most of the players are from the immigrant community. And what they did, his leadership team got together, virtually. Of course, all this is online, at the beginning of that crisis, and said, "Okay, out of the about 200, these are mostly young men, some teenagers, but mostly young adult men." Out of about 200 regular players, who feel safe to go to get groceries and to drive around in a car. And they identified about 15 of them, and they got together and they started going out and buying groceries for the others who didn't feel safe to leave their homes. And and the local soccer club, Hearts of Pine, actually gave them a bunch of money to buy groceries. And then there was one time they were standing in line at Market Basket, and somebody recognized them from Kennedy Park and just said, here's a couple $100, just go buy more groceries. So it was a real, again, working together, helping each other out as a team. So I think that one thing that, I think I learned from both of these crises is how, we all are getting through life, really as a team, and that the importance of that social bridging. And I think some of the women I texted that morning trying to identify some people who could quickly go and pick up some of our EVS team members and take them to work. They tell me they're still in touch with some of those people, that I mean, to be honest with you, they didn't know many immigrants. And so that now they do, and they're learning a great deal from them. And it's a cross bridging. It's back and forth. So I think that's, kind of what we need a lot more of, is the fact that we're going through life together as a team. But as any team, we all, we all gain from each other. But it is that cross bridging that seems to be very important, whether it was COVID, or the most recent uh, challenge that we faced in January, with with the ICE arrests and things. So I'm going to pass the baton back to Isha. Thanks.
Well, thank you, Dora, for walking us through like these real life scenarios that we're all facing on a daily basis. And also just painting or helping understand, like, we typically say when one person is impacted by injustice, everyone else is too. You are too. And in this case, the examples you've shared really do make it palatable to understand these big changes that we're facing, whether it is just the mere fact that you gave a great example of environmental services. If we don't have environmental services employees, there are no clean beds. If there are no clean beds, there's no patient care. If there's no patient care, we're impacting a large population. So, as we think about this session, what is leadership response? And some of the things I want to pull out of just hearing from you and really get more feedback from you some of the things I've heard you mention is kind of the idea around the partnership that you already had, how critical it was. And it makes me think that, psychological safety must exist before any crisis. We can suddenly invent safety during emergency, and that these partnerships are so needed, whether it is our ethnic-based communities that we're connecting with, whether it's our rural communities that we are connecting with, folks from different backgrounds who are deeply impacted and are also part of the fabric of our communities or workplace, that engaging them not just when there's a crisis, but engaging them and having tr real and true conversations and partnership is what makes, these big challenges still addressable. So I think one thing I pulled from your conversation was this idea of psychological safety that must exist before. And similar to you, you mentioned another great thing around the real needs people have, whether it is transportation or food. And oftentimes, as we work together with so many different people, you don't really have a sense of who you truly are working with. And this earlier this year was like a big eye opener as, community members or other people went and picked up people. You recognize that this is just another add-on to someone who may be struggling with housing, transportation, food, just to begin with, and what this impact of these new emerging disruptions can be. Myself, I remember and I still do carry my passport, and that, is another additional burden that I never thought as, as a young professional going to Hannaford, like I need to carry my passport. But these are the new realities, and I think the social bridging you were talking about, and how do we engage not just a specific group of people, but really engage the broader community who is so eager to be helpful, is so eager to find ways to contribute. So all of this is just so, so important. So, Dora, as we're kind of getting towards these pulling these lessons, can you expand a bit more on the idea of social bridging and diversity, not just as a moral proposition, but really is the foundation and infrastructure for a healthy and thriving population, especially in Maine, where we have a lot of aging population that are gracefully aging, and how there is such a need for diverse hiring, retention, and of attracting talent pool from all different backgrounds. And you're still on mute, sorry.
I'm sorry about that. So, and I was just, yes, thank you, Isha. And I was also mentioning Kathleen's got some very nice comments and in the chat as well. And then yeah, it's I feel like there's several principles that we've kind of touched upon, and you particularly that psychological safety has to exist before the crisis, right? So we all when we need a diverse workforce, we all do better when we have a diverse workforce. But we also need to work on engagement, that social bridging, I call it. And people are probably familiar with social bridging as a concept. It was one that was put out by Robert Putnam in the 1990s. He wrote a book called Bowling Alone. And there's a movie based on his work called Join or Die. Not it's a weird title, but I think you could find it for free, or it's on, I think, Netflix or something too. But anyway, so, but his idea is that his theory, it was a Harvard professor, is that we need social bridging, that is, the bridging across different demographics. So young people need to be able to relate to older people and vice versa. People of different races, ethnic backgrounds and cultural backgrounds need to be able um, to understand each other and to be able to have relationships and friendly relationships, um, and that we it's that social bridging is a component, a characteristic of American society that has allowed us the tremendous creativity that has come out of the American experience, and has really built the foundation of so much of our society. He says, "Oh yeah," and Tony says, "Bowling Alone's it's a great book." Yes, um, and so he says it's what's different about the United States than so many other countries. But in the 1990s, he wrote this book because he said we were losing a lot of it, believe it or not, because of television, which is sort of funny because it was before we had commonly had laptops. It was before the advent of social media and certainly before cell phones. So cell phones that became cameras and social media windows and all kinds of other things. So or little thing, little pieces of addiction. So he's so his theory about the loss of social bridging came out before all that, and then now we had him on a public health grand rounds last June, I think. So if you go to Maine Health Public Health Grand Rounds, there should be a link to the video that from our his public health grand rounds that he did for us um, last June, I believe it was. I had contacted him and he actually responded. Who knew? But he's in his late 80s, lives in New Hampshire now. But he's wonderful. But he talks about his biggest fear in the country right now is this loss of social bridging. And he says it was in the concept of bowling alone had to do with the fact that when he grew up in, I think it was Ohio, that they had these bowling leagues and people came from all over different demographics, working class, executives, different types of people coming together, different religions and cultures and all that came together like on Tuesday night for bowling leagues. And that was one of those social bridging activities, but it helped them to bond. So if you were uh, Jewish, you knew somebody who, because he was brought up Jewish. He says, but anyway, but he knew people who were Catholic because they were in the same bowling league, as an example. So, and that's what kind of helped form this very strong uh, bridging for the foundation for the community, foundation for the community. But he said we're starting to lose it because people were distracted by television. And so that's why he came up with this title of the book called Bowling Alone, because what he found out was from talking to some bowling alley owners is that they didn't have bowling leagues anymore. And people would come in sometimes and bowl alone. I thought, oh my gosh, I can't imagine bowling alone. Anyway, so now of course the issue is even more exacerbated because of all the other distractions that we have. But also we've had this, we don't necessarily have the gathering kind of spaces that we used to have. So as in a workplace, he talks about how important it is that we build those social bridges so that people, and I remember hearing from one of our EVS workers that um, team members that when he walks down the hallway that a lot of the nurses and doctors don't necessarily say hi to him, but they'll say hi to other nurses and doctors. Oh my gosh, I mean, it just so that's kind of and I think that's probably really common. So the idea is that we build those social bridges wherever we're at work, at play, in our home lives. Um, During the ice crisis in January, um, I remember seeing some kids on the bus with their parents across not far from where I live, and just went over there several mornings just to stand at the bus stop so the parents could stay inside. And then got to know some of the parents, some of the kids. And I realized, gosh, they're in my neighborhood and I didn't even know them. And I felt kind of embarrassed. Like I know neighbors of mine in my condo complex, but I didn't know neighbors in the next in the complex near us, which just mostly have a lot of immigrants. So that's the idea that we all, wherever we are, that we try to do a lot more social bridging because that is such a key characteristic and foundation for for our society. So as employers, we can do that by just simply trying to have our employee settings, work settings, trying to have places where people do come together physically, not just online. Um, and that helps us to get through these crises. So, as an example, with the crisis in January, we do now have a lot more ride sharing that we didn't have before. That is, people have kind of organically said, well, look, I live near you. I go to work at the same time. I can give you a ride, and vice versa. We could share rides. So we can help each other out. Um, and the same thing if we had another pandemic, which we will at some point in time, because we always do, um, then, again, we can help each other out. So I think that social bridging is a major concept that I think we all can play a role in and think about what we can do. Again, even realized I didn't know some of my own neighbors that well, or people in my neighborhood. So, and the ice crisis kind of helped me to bridge that gap. So, in closing, I think that's, recognized diversity is really essential to our system stability, and investing in that in resilience. It really is I think the social bridging is a major component of our workforce resilience and to protecting our community well-being. And I'll just end with I don't know about some of you, but I'm kind of getting excited. I'm going to watch the launch of the Artemis 2 mission going to the moon. And I remember I have to tell you how old I was 9 years old when we last, I guess, one of the last times we went up to, one of the times Apollo went up to the moon, and then when people first started working on the moon, but walking on the moon, and and that brought the world together. It was just all of us having this communal experience of watching um, that Neil Armstrong take those first steps on the moon. And I think about those kinds of communal experiences, and we've got one this evening. So grab somebody you don't usually see and watch it together. Maybe that's just a quick thing that we can all do. And if you're at work this evening, grab some people and turn on a television to watch it. So, um, and Jan, oh my gosh, you got to watch from Cape Kennedy last time. That's great. Anyway, thank you so much. It's wonderful to be a part of this, and I hope that this continues to go well. And thank you so much for pivoting and continuing to have this conference, even though it's virtual, and hopefully next year in person. So thank you so much, and thank you, Isha, as always.
Thank you so much, Dora. This was great. Thank you for setting the stage on what social bridging looks like on an organizational level, working with different organizations beyond the four walls of a hospital or a business, as well as creating social bridges between employees and colleagues, and then bringing it home, like what social bridging can look like in our own neighborhood. So, thank you so much for being here and joining us.